Hello, and thank you for your interest in how to perform an exorcism in the situation where you are a dentist in an emergency situation. I'm David Harger, and this video is intended to instruct you through the stressful situation of an emergency when a patient you may be seeing is possessed by Satan or Lucifer, or in the worst case scenario, the devil himself. I'm here to show you how to handle that situation. Let's start with step one, how to recognize when you think a patient may or may not be possessed by the devil. The best time to notice if a patient may or may not be possessed is actually when they're walking into the operatory. If they levitate, it's a telltale sign that they may be possessed. Also, jerking motions. I'm going to show you an example of a patient that might look possessed.
Okay. Okay, what is the patient's name, please?
Satan. So now you've seen the patient come into your office and you're already suspicious that there may be in a medical emergency situation that may need to be handled by you because you're the doctor. Sorry, just a dentist. So the next step is an accurate medical history. Always update the medical history every visit. Even if you saw the patient the same day, you need to update the medical history to see if they have been worshiping the devil. I'll take you through a few short examples. It's nice to meet you, Mr. Satan. Looks like in your health history you report a history of asthma. How's that been landing? Oh, you have your inhaler. Okay, good, good. Okay, a few other things here. Have you had an organ transplant? No. Bisphosphonates, anything, prostate disease, kidney disease, liver disease, bleeding disorders, stomach, intestine, bleeding diseases, none of that, HIV, AIDS, acquired immunodeficiency, either acquired or congenital, no, none of that. Wait for it. Do you have a history of worshiping the devil? Interesting. And how many times a week would you say you worship the devil? And how many Hail Marys did you say this morning? That's a lot. That's a significant amount of Hail Marys. In the dark, too. Okay. Great. Let's go ahead and take your blood pressure, see what we get. Just as I suspected, 0 over 0. This patient may be possessed. Mr. Lucifer, it looks like your blood pressure is exceedingly low. Have you been seeing your physician regularly for that? There could be some medications I might want you to take, or he may want you to take. No? Your blood pressure is always 0 over 0? That's normal? Oh, you're just nervous because you're at the dentist. Okay, okay. Let me put that in your health history. Okay, great. Let's go ahead and get started. Now, while no blood pressure, jerking motions, levitation, and a history of worshiping the devil are all very, very accurate signs of how to tell if your patient may be possessed by Satan, the most important sign is vomiting. That's when you know you have a medical emergency that might require expertise in dealing with the dark side. At this point, you have a medical emergency. The patient has vomited and reported a history of worshiping Satan. This is a big deal. Step one, put the patient in the semi-supine position. The dark side hates the semi-supine position, particularly because it supports the back in a way that makes one glare towards heaven. And the dark side does not like that. So, step one, Okay, Miss Lucifer, I'm going to put you in the semi supine position now. I'm sorry that you just threw up on yourself. That's no fun. Okay, just putting you back. It's also important at this stage to stay calm because the devil can tell if you're freaked out. And then you may become possessed as well, and that is not going to help the situation one bit. Next is to alert the emergency medical response. You get the crash cart. You get a young priest. You get an old priest. You just stand there and watch me work. Thanks for getting the crash cart, Pablo. Good job. There's no crucifix on this crash cart. Now, if your crash cart isn't equipped with a crucifix, what you need to do is get 2 sticks from the wilderness, preferably, and some twine. Twine is very important. Here is the makeshift crucifix that you can make just using twine and a little bit of time and some sticks from the wilderness, of course. Now, when performing an exorcism, it's important to say the power of Christ compels you at a minimum 3 times to the patient that's currently being possessed by the devil. The power of Christ compels you. The power of Christ compels you. The power of Christ compels you. It didn't work. We're going to have to pull out the big guns in this situation. Now, the big guns in this situation is going to be holy water. So you're going to need 1 step of holy, but preferably written backwards. That's important. And also, a little bit of water. Add the holy to the water. Stir it up. Stir it up. Perfect. Now you're ready to perform an exorcism. Nailed it. Possessed by the devil. I love the devil. Devil, 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 devil. Hey, is that holy water? Ah, what's all the water? Jeez. Oh, look at this nice little cross. That's nice. Was I possessed? Thanks, Dr. Harger. You're the best. Oftentimes, patients really do appreciate having their, their evil spirits taken away or exorcised. You've exorcised their demons. Patients really appreciate this. It saves them a lot of time and wasted money on things like church camp, church in general. Just things like that. It's really a good service to the patient. And so I really recommend doing that for your patient. It's a great way to help your patient with the... Thank you for taking the time to learn how to properly exorcise the demons. It's very important in your medical practice to understand how to handle these emergency situations.
Damn, it feels good to be a gangster.
Summoned. Thanks again. You'll save your patients a lot of anguish, time, and you'll maybe even save a life. And that's what's the most important thing when exercising demons.
Damn, it feels good to be a gangster. A real